I'm going to be the director of what's called the National Center for Injury Prevention and Control. It's one of the big centers at the CDC.
And does that mean you'll be moving out of Chicago?
It means I will be getting an apartment in Atlanta. That is where the CDC is based. But I'm keeping my home here in Chicago. I know I'll have to travel a lot anyway for this job. I'll be in DC, I'll be in Atlanta, but this is my long-term home. So I'll be keeping it and doing a little bit of backing and forthing, but we'll be spending the majority of my time, certainly initially, in Atlanta.
All right. And tell us, what is this job? What does it mean as a director?
Yeah, so it means I'm going to be overseeing one of the centers of CDC. CDC stands for Centers for Disease Control and Prevention. And this is the center that works on overdose prevention, violence prevention, suicide prevention, and then other injury prevention. So it's a big center. There's a lot of people who work for it, but it means that I'll be working with scientists and epidemiologists. It means I'll be working with folks who think about funding and grant making. It'll be with folks who think about supporting this work all over the country, in all of the states, and really a lot of the cities. So it'll be a different focus because, as you know, I have been all about Chicago for these last 8 years, but I am excited about it, and we'll have a lot to learn, but you know I like to learn things, and there's amazing scientists and others really thinking about this work at CDC. I'll just get to bring, I think, a lot of practical knowledge about implementation of programs and working on mental health and violence prevention and substance use work here in Chicago, which we've done a lot of here.
And what attracted you to this job? I would think you probably had a few to sift through of offers. And why was this one appealing?
Yeah, so for a number of reasons. You know, I've worked for the CDC before. I do think they do amazing science and the ability to work on the biggest public health problems like this. In my opinion, now that COVID seems to be receding in a long-term kind of way, although it's certainly not gone, I actually do think that these are the biggest problems facing the country right now. And I think having strong, coordinated public health approaches to them is really what's needed. You look at, you know, this being the leading causes of death. You look at all of the ways in which we don't really have a handle on these issues. I am someone who does not shy away from working on big problems. And I was excited to get to work on something that felt a little bit different. You know, I have loved my time here in Chicago and with the health department. I didn't want to just move to another city or to another state and replicate that work. I wanted to do something that felt different and might have a different level of impact and learning for me.
And is it sort of all ages, or are you focused? Is it at all age centered?
It is an all age center. Yes, it's really, as I've been learning more about this role, it's a wide range of activities. It's you know, the ones that tend to be most front and center are a lot of the overdose work, for example, or the violence prevention work, but they work on things like motor vehicle crashes even, or drowning prevention. Basically, the things that are not diseases per se, but that lead to a lot of death and a lot of indirect impacts in Chicago and around the country. And so there's teams that work on this. It includes actually some international work and research where they're thinking about how to take things that have worked in one setting and move them to another. So it's a big portfolio for sure. But I will, as I have always done, you know, I will trust that team as I come to know it. There's people who have dedicated their lives to working on these issues. And I think my strengths often come in the areas of being able to pull work together, to translate it and communicate about it, to really think about prioritizing, to bring an equity focus, which, as you know, has been so much of what we've done here. And it's a big need in a lot of these areas. And then I think just to build teams and coalitions and the will to work on these issues with a public health approach.
Well, I know that when we did our interview before, so many people responded to that and wanted, you know, to tell you how much they appreciated your work in Chicago. And I don't know how to summarize it, but how do you look back of your time? You know, certainly COVID was this, who had thought that was going to hit us, But what do you think will be your biggest takeaway?
Yeah, I mean, I am just so grateful and thankful to my team, proud of the work that we've done over the last 8 years when I was in leadership roles at the Chicago Department of Public Health. I think some of my biggest takeaways were that you have to have good, actionable, local, up-to-date data to drive decisions. You think about during COVID, you were seeing really every day what's happening in all of these spaces. We could look at that data, use it to change direction, invest in different areas, evaluate approaches we were taking. And I think that real-time data needs to be replicated in other areas of public health, including some of the areas that I'll be working on. I also think I learned so much about building real, honest coalitions, listening to people who don't agree with you, adjusting directions when things aren't working. I learned from my team how to fight, how to compromise, how to be a good leader, how to care for a whole city, right? While caring for each other as a team. I didn't really know how to do any of that when I started in an applied way here in Chicago. So I do think I'm so grateful for the lessons that I've learned. I am proud of the work, but I am always going to be a public health person. That's just who I am. If I had stayed on in Chicago, these are probably the issues I would have been working on a lot here. And this would be the opportunity to, to take that and to take those lessons and apply them nationally. So lots to learn, lots to do, but I'm looking forward to the challenge.
Oh, I bet. So you're going to be so missed. We wonder though, might you still squeeze in a architectural boat tour? I want to go on one.
Yes. Yes. I am planning on it. Let me tell you. So, like I said, I'll be getting an apartment in Atlanta. I'll be based there. That's where the CDC is headquartered, spending most of the time there, certainly initially, but Chicago is my long-term home. I have not and do not intend to resign as a docent with the Chicago Architecture Center. And I'm going to be back here. This is my long-term home. I'm keeping my home here. And yes, I very much expect that next year, it'll be probably on weekends or in between when I'm not doing my primary work with CDC. But yes, I'm not going anywhere from a Chicago perspective in terms of being connected to the people I love, the things I love doing. So I probably won't do quite as many tours, but I do expect at this point that it's something I'll continue doing because it's a way to relax. It's a way to bring kind of public health teaching into other spaces. And I just, I